And I want to talk about, I mentioned the other day that there was this effort, and many of you likely saw it, there was an effort by doctors around this country to come to Washington, and they held a news conference, a press conference, a doctors conference. They called themselves the Frontline Doctors, America's Frontline Doctors, and they basically came to Washington to say, we would like to speak to the American people and say, we, doctors, are treating patients with COVID-19, and we're treating them using hydroxychloroquine, and we're treating them and finding that treatment effective. They're saying they are finding an effective treatment for COVID-19. And they had to hold a press conference. I mean, in what other disease in America do doctors have to fly to Washington and assemble a press conference in order to announce they found something good that's working on a disease that is scaring America? No other disease, but this disease, this coronavirus, which causes COVID-19 in a small number of people who come into contact with coronavirus, these doctors had to get on a plane and fly to Washington because their life experience, their actual treating of patients, their effective treating of patients is being smothered by the media. Smothered. People who try to put statements up on Facebook and YouTube get smothered, censored. They aren't allowed to talk about what they are seeing. These doctors sharing the story, Americans trying to pass along their own stories, Americans trying to share stories about these doctors, censored by all of the social media giants. So these doctors held a press conference. It went viral, of course, as you might imagine, viral on YouTube and Twitter, and videos up of these doctors saying, hi, I'm Dr. So-and-so, and I've been treating COVID patients with hydroxychloroquine and whatever the other stuff is that goes with it, zinc and something else, and they're finding they are getting over it, they're recovering. And so that went viral. YouTube takes it down, Facebook takes it down, Twitter takes it down. Everyone is trying, these social media giants are trying to tell Americans, trying to keep Americans from hearing this information. It is in any other universe, in any other time, would be insane. But it's the norm. The notice people get on Facebook that says, your posting violates community standards relating to coronavirus, putting out basically fake news about coronavirus. These are the same people that want you scared to death, that publicize headlines all day long about number of new cases, new tests, positive test results, new cases. Oh my gosh, get so scared. Stay home, stay in your house, put on a mask, don't socially distance, never go anyplace. All these people working into a frenzied lather of fear with new headlines will not let doctors talk to the American people about what they are discovering, which is that their treatment is working. But there's a particular doctor I mentioned, Stella Immanuel. The left is so determined to shut down the American people from ever understanding that there are actually effective treatments for COVID-19 because they're so in bed with the radical left who wants to have everyone freeze in fear until the vaccine comes along. But the one particular doctor, and she wasn't the only one, she was one of many doctors, there's 10 or 12 doctors up there trying to talk to the American public and say, hey, we're finding good results. You guys should want to hear this. But the one doctor that the Democrat media mob is picking on is Stella Immanuel. She is a woman doctor. She is from the country of Nigeria. She grew up in Nigeria. She had her medical training in Nigeria. She obviously speaks with an accent, but she's a doctor in Houston. And she said in this conference that she has had approximately 350 COVID-19 patients who have found hydroxychloroquine was effective in bringing relief from their symptoms, in treating coronavirus. I guess the word cure is kind of, people get nervous about the word cure because the hydroxychloroquine doesn't kill the virus, but it makes a person better so they can go around and function. They're done. They're healthy. They're on their way. They're done being sick. And so this woman, Dr. Stella Immanuel, told America 350 patients she's done this with, And the answer of the media is to focus on the fact that she has an accent, that she is from Africa, and apparently, I don't even know if they're true, but to focus on things she allegedly said at some point in time that may come from more of her Nigerian historic roots, things that don't comport with modern medicine. But she wasn't the only doctor up there. There were a bunch of them, and she wasn't the only doctor saying hydroxychloroquine works. But the media still, if anyone talks about it, anyone tries to share the video, anyone tries to do anything to bring that information out, social media shuts you down. They punish you. They tell you can't talk about this. It is a very alarming time in our country, my friends. If you can't have doctors telling America, we found effective treatment. So I want to tell you, I have a few of the other doctors who were there, just so you know. Congressman Norman was there, by the way, but one doctor, Simone Gold, said, you can find the information at America's Frontline Doctors. And there are many other sites that are streaming this on Facebook Live. We implore you to hear this because our message has been silenced. There are many thousands of physicians who've been silenced for telling the American people the good news about the situation. Next, a Dr. Bob Hamilton from Santa Monica, California. He's a pediatrician, pediatrician, been in private practice 35 years. He's saying, fortunately, the mortality rate for children who come into contact with coronavirus is 1/5 of 1%. So kids don't even get sick with it. When they do, the mortality rate is 1/5 of 1%. Kids are tolerating it well. And he added, children are not drivers of this pandemic. He quoted a Dr. Mark Woolhouse from Scotland who said, there has not been one documented case of COVID transferred from a student to a teacher in the world. Another doctor who was there, I think you have to understand, because the media is trying to say, oh, crazy Dr. Immanuel from Nigeria, she's not to ignore these people. All these other doctors were there. Trump, in his presser this morning, or yesterday, whenever it was, commented about how, hey, you know what I really care? I'm in favor of saving lives. He's again talking about hydroxychloroquine, saying, hey, I took it, didn't hurt me, seemed to help. And he says he's in favor of saving lives. What are the social media giants in favor of? Ask yourself that. Doctors are saving lives. They're trying to tell people, and social media giants shut them down. What are they in favor of? But again, I digress. Other doctors who also talk about it. Stella Immanuel tells her whole long story. 350 patients, and she had a lot of really punchy lines. But I'll mention also Dr. Dan Erickson. If that name sounds familiar, he was one of the doctors in California early on in this whole coronavirus who did a little sit-down press conference in his medical clinic to say, hey, shutting down, quarantining the healthy is unwise. I was calling it house arrest for the healthy. Quarantining the healthy is unhealthy, unwise, unnecessary. Nobody should be forced to stay home if they are healthy. He got shut down. Social media giants shut him down. He showed up to say, he says, when you lock people down, it causes public health issues. Our suicide hotlines are up 600%. Suicide hotlines up 600%. Our spousal abuse numbers are up. Different areas of alcoholism, they're all on the rise. So there are many doctors trying to speak at this conference, and the social media giants' answer is to shut them down, mock them, and tell America, don't listen to these people. Look, let's focus yourself on Stella Immanuel. She's a little weird. Actually, you could kind of question whether the social media giants are kind of racist, because she happens to be a real African American, an American from Africa, who speaks with an accent and is a doctor, and they mock and ridicule her. Last point I want to make on this story, and that is, again, I mentioned a couple days ago, I think, but there is also a doctor, again, out of the Yale School of Public Health, Dr. Harvey Risch, R-I-S-C-H, also talking about hydroxychloroquine, very, very effective. He said the key to defeating COVID-19 already exists. We need to start using it. And he's talking about hydroxychloroquine, great piece. Okay, and on this topic, last wrap up on COVID-19 is to say, On this show this coming Wednesday, next week and Wednesday, we'll have Dr. Bartlett back. He is the Midland, Texas-based doctor who's joined me in the show before, and he's the one also treating COVID-19 with a different treatment, the inhaled steroid. He's using a nebulizer, inhaled budesonide, and he's saying he's finding the same thing. Whether in his case, he says, whether it's a mild, moderate, or severe case, he's finding this treatment is successful. It is healing people with COVID-19. We had a patient of his who actually drove into this studio from Midland, which is like 6 or 7 hours, just to come on with you for 15 minutes to say he was practically dying. He was typing out his last will and testament on his phone, couldn't get out of bed, connected with Dr. Bartlett, took the treatment Dr. Bartlett recommends, and is now perfectly healthy. Practically teary, trying to tell his story. People, this is a crisis. The crisis in our country is not COVID-19. The crisis is a pandemic of fear, the suppression of the solutions that are working, suppression of doctors, actual doctors on the ground who are telling Americans about solutions, and yet you have all the social media giants enabled by much of the Washington establishment, not Trump, but the Washington establishment, dead set against finding any solutions to the COVID-19, to the coronavirus, because they are so invested in many ways, professionally, financially, intellectually, invested in forcing more Americans to die, to stay home and die, rather than find these effective solutions, because what they really want is this vaccine that they think, and there may be a great vaccine coming. I don't know. I hope there is a great vaccine coming, but we don't know that. In the meantime, as all these doctors are saying, Americans don't need to be dying. We have a treatment. We just have an astonishing suppression by the government and by social media in letting people learn about it.